In approaching this whole back problem that I had a number of people on what I would think of as my medical team. And it probably started with my general practitioner. He knew my situation, he knew about the previous problems that I'd had.
Yeah, communication with all the doctors was really key. I've had the same physician for 20 years, so she knows my whole history.
I saw, I believe, 3 other doctors that were specific to the back issue. And all of them were important to that team in that they all had information and opinions that were part of my decision process.
One of the things I did before I had this procedure, did my own little homework on the doctors. When I finally went and saw my doctor, I was comfortable with him. He made me feel like he cared.
When a patient comes to see me in the office, I really encourage them to bring a list of questions they have, bring a significant other, a caregiver with them, somebody else who can hear what I had to say and help interpret what it was after the fact.
So you got to be comfortable with whoever you're going to use, because that alone can put you at ease. And when I did have my surgery, I was confident that he could do the job.
I do feel like it helps to talk to people and also just see how you feel about your doctor. It's like going on an interview. You know, if you go and you don't like them, go somewhere else. Or if you go and you really like them, you can still get a second opinion.
Patients can be surprised that their surgeon sends them to a pain doctor. Patient says, doesn't the surgeon know what's wrong with me? Well, yes. And you should be grateful that your surgeon sent you to the pain doctor, because what your surgeon wants to know is, firstly, can this problem be treated without surgery?
So it's this balance between, when I first meet with somebody, I explain to them what our whole treatment options are, starting with oral medications, rest, then physical therapy, maybe a spinal injection to decrease inflammation to allow them to do the physical therapy, and then ultimately what surgery we're talking about. What are our options, and what are the odds that you're going to need it, and what's the potential outcome of the surgery?
I made a plan with him, and he said, I don't think we need to go to surgery yet. Let's do this and this. And we went through all the steps. Obviously the diagnoses, the MRIs, the CAT scans.
My back doctor is somebody I could email night or day. I've driven him crazy with questions, asking why this, why that, why can't I do this? He's been unbelievably patient with me.
I mean, doctors tell you what you need to do, and if you follow those orders, you'll be okay.
That sounds very sort of obvious, but it's not, because you're overwhelmed by feelings and emotions.
I think a better informed patient is going to be a better healing patient.
Establishing a relationship with a doctor, it's a journey. You have to find someone that's smart, that you have a connection with, that listens to you, and that you trust.